Good evening, everyone. I'm Keishla Adderley. Thanks so much for joining us tonight. Well, topping the news, health officials are refuting claims on social media that there's been a death due to malaria on board a vessel which landed in the Bahamas. To the contrary, health officials in a press statement advised that there have been no deaths due to malaria. We spoke with health officials about this scare, and they say that all cases of malaria to date have been treated appropriately.
Yesterday, there was a voice note being circulated, and ordinarily there's no reason to respond, except that the contents of this note made some allegations with significant public health implications. An unknown voice would have suggested that there may have been a death from malaria in the Bahamas, and that more importantly, perhaps persons exposed to malaria had left a particular boat and gone into the communities in Nassau. And rather than allowing such a message to go unanswered, in order to reassure the public that we have a very active and aggressive surveillance system, we constantly monitor activity through the Defense Force, at the ports, at the airports. We communicate in a multi-agency fashion, and there was absolutely no truth to that story. It is unusual, yes, to respond to every single social media statement, but this one had implications that could cause public panic.
Meantime, the health minister is responding to criticism over the implementation of national health insurance. Vern Carey has the story.
Health Minister Dr. Dwayne Sands responding to concerns from the Medical Association of the Bahamas regarding national health insurance. Last week, President of the Medical Association, Dr. Cy Pierre, said he did not understand why the government is pushing forward with NHI as it offers nothing that is not presently available in the public health care system. He suggested that NHI should focus on catastrophic care instead. The health minister noted that while there are challenges with the health plan, the newly appointed National Health Insurance Authority is already working to address them.
Prime Minister Dr. Minnis made it very clear that national health insurance is here to stay, that we need to do some things to get it better, to make it work, and we have set about addressing that. The board of the National Health Insurance Authority was just announced. They have already started the process of getting to work. Their appointment letters have been mailed. The chairman has met with the secretariat.
Dr. Sands says that once the challenges with national health insurance are addressed, the investment will significantly benefit the Bahamian people.
The concept of prematurely bringing something to the Bahamian public which was not ready for prime time, we've learned was a mistake. We have to now fix that. We need to make sure that Bahamians get not only value for money, but that the incremental improvement to their health care and to the indicators that say that we're doing a good job will prove that it was worth the investment.
Vern Carey, CNS Network News.